Hello, my name is Dr. Kristen Jankowski, and I'm a veterinary educator with a special interest in access to care and contextualized care. This is a step-by-step where we guide practitioners through important veterinary conditions and issues step by step. Today, we are talking through Open Door Veterinary Collective's Patient-Specific Care SOAP. We will discuss how the whole team can work together to reduce barriers to care. With an easy-to-follow plan for everyone in the clinic, more clients will be able to accept and follow through with care plans, and more pets will get the care they need. In this algorithm, to make it easier to understand, I'm going to use a case example that we all deal with every day, the wellness or preventive care visit. So first, we start with preparing, and that can start with the CSR scheduling an appointment with the client. They're going to collect the normal information when the client is scheduled or checked in, just like usual, patient signalment, prior medical records, and the client's goals for the visit. Something that may be new to you is collecting a financial signalment, and that's to create an initial financial triage code. If the client can pay up front, the client will be coded G for green. If the client is interested in pay over time, they'd be coded Y for yellow. And if the client needs subsidy, they can be coded R for red. If a client is asked by the CSR, "Are you interested in hearing about the payment options at our clinic today?" and they say yes, and they're presenting for something like a wellness appointment, this can prompt the CSR to not only share this information with the technician and veterinarian early, but to start to think about options. And this can be very helpful to just normalize the cost of care discussions right up front, right out of the gate. Next is assessment. The veterinarian and their care team meets the client for the appointment for the first time. During the visit, the technician or veterinarian is going to confirm the client information once again, making sure we're on the same page. And we're going to confirm that financial code, that G, Y, or R. Once again, normalizing the cost of care right from the start, having no judgment, no shame, and talking about money. And then the veterinarian's going to conduct a talking physical exam that really helps to share the information with the client on what's being found right in the moment, allowing them to interject if they have additional thoughts. And then we use an abbreviation that can help to remember just how to go through the process. We call it SCORED. And S is for summarize. Summarize that you've heard the client. You know they might have financial concerns, and you know what their goals are. You're going to connect. Really take time to connect with the client and the patient, making the visit feel more comfortable for everyone. O and R are for offer recommendations. And we like to phrase it this way of offering, so you're not telling, you're offering and offering choices. And then of course, D for document. Documentation in the medical record is what helps us to meet the standard of care at all times. The next section is planning. The veterinarian and their care team engages the client to establish a plan that they both feel good about. You're going to formulate and finalize a care plan with the client. You want to ensure that the client has multiple options that address their goals and financial needs. Once again, if we're having a wellness visit and it might be a middle-aged pet, that we could offer some screening lab work. Perhaps if they've expressed that they have financial concerns, that lab work could be done in a month or two. If they can only afford the visit today, maybe they want to start with that and a heartworm, antigen, and microfilariae test, and come back for the CBC chem and urinalysis in a month or two to spread the costs out. That is something that is easily offered and really just shows the client you're listening, responding, and meeting them where they are. You want to share decision-making with the clients for the treatment options, just like we talked about, finding a care plan that works. Document the treatment options offered, declined, chosen, and the client's reasoning. Just skipping over things because a client has expressed financial concerns is not the right way to go either. You want to offer the full range of options and let them choose something that feels good, documenting what they have chosen. You want to discuss the next steps and initial client education, and circle back, confirm whether those client goals have been met. Make sure we're not missing anything. During those client conversations, we have an abbreviation that may help you called SCOUT. And S is for sharing results and presumptive diagnosis. For instance, with our preventive wellness visit, you might say, "Great news, Mr. Lee, Comet's heartworm and antigen and microlearning tests were both negative. That's excellent. You've been doing wonderful preventive care at home." And then you can talk about next plans. You're going to check in to make sure they understand what you expressed with test results. O is for offer options. At that point, the client might be so excited that the initial lab work showed that things were great, they may have changed their mind and want to do that CBC, Chem, UA just to get a baseline today to feel a little better. At all points, use your U for unconditional positive regard, demonstrating that at every moment you are on their side and really trying to work to find a plan that fits their unique situation with their own pet. And then T for transition to a technician. That's going to help with your efficiencies. If the technician can share information on client information, what needs to happen with next steps, how to go home, and do follow-up plans, things like that. The last piece is follow-up. You're going to discharge the patient and follow up with the client. You're going to use the whole veterinary office to do this piece, once again for efficiency. You're going to finalize the visit and ensure continuity of care, have your team fill and dispense medications or write RXs. For something like a wellness visit, there are a range of options we can offer. Perhaps they need a generic heart prevention to afford that, and you don't carry a generic at your clinic, but you're willing to write an RX so they can get that and that dog can stay on heart prevention. You're going to provide detailed condition-specific education. You're going to schedule rechecks or telehealth visit. If it was a wellness visit, you found that pet was a little overconditioned, maybe you schedule for them to come back to get away, check in, and reward them for their goals, meeting there. You're going to collect payment upfront or do your pay over time options if you've decided upon that, getting everything clearly established so everyone feels comfortable. You're going to document the outcomes and check again whether the client's goals were achieved. Provide the client with a satisfaction survey. If they have great things to say, you want to know. If they have places you need to make improvement, it's also a wonderful time to find out. The last piece is initiate a callback to follow up per your clinic protocol, whatever your normal time is to check in for the wellness visit. Maybe it's to schedule that follow-up blood work they decided to do to make sure you stay on track for that. And that's how you go through a step-by-step with Open Doors patient-specific care plan. Thank you for joining us for this edition of Step by Step. More resources on how to improve access to care in your clinic can be found on vetfolio.com and opendoorconsults.org.